What was the main approach to treating abnormal behavior in ancient civilizations such as Egypt and Greece? A. Exorcism. B. Psychotherapy. C. Herbal remedies. A. Exorcism. In ancient civilizations, abnormal behavior was often believed to be caused by evil spirits or demons. Thus, exorcism, or the expulsion of these spirits, was a common method of treatment. The theory of the humors was popularized by which ancient Greek physician? A. Hippocrates. B. Galen. C. Aristotle. A. Hippocrates. Hippocrates proposed the theory of the four humors: blood, phlegm, black bile, and yellow bile, which were thought to influence a person's physical and mental health. Imbalances in these humors were believed to cause abnormal behavior. Who introduced the concept of moral treatment for individuals with mental illness in the 18th century? A. Philippe Pinel. B. Émile Kraepelin. C. Johann Christian Riehl. A. Philippe Pinel. Philippe Pinel advocated for humane treatment of individuals with mental illness, emphasizing kindness, compassion, and providing a therapeutic environment rather than harsh confinement or punishment. The term hysteria was historically associated with which psychological disorder primarily affecting women? A. Schizophrenia. B. Bipolar disorder. C. Conversion disorder. C. Conversion disorder. Historically, hysteria was used to describe a range of symptoms, often neurological or psychosomatic, predominantly observed in women, such as paralysis, seizures, or blindness, without a discernible organic cause. Who proposed the idea of psychological introspection as a method for studying mental processes? A. William James. B. John Watson. C. Edward Titchener. C. Edward Titchener. Edward Titchener, a prominent structuralist psychologist, advocated for psychological introspection, which involved careful self-observation and reporting of one's conscious experiences to study the structure of the mind. Who developed the first system for classifying mental disorders? A. Émile Kraepelin. B. Philippe Pinel. C. Sigmund Freud. A. Émile Kraepelin, 1856–1926, was a German psychiatrist who is considered a pioneer in classification of mental disorders. In the late 1800s, Kraepelin distinguished between two major categories of psychosis: dementia praecox, later called schizophrenia, and manic depression, now known as bipolar disorder. This laid the foundation for categorizing types of psychotic disorders. How were disorders categorized in the DSM-1? A. By cause. B. By symptoms. C. By both symptoms and cause. B. By symptoms. In the DSM-1, disorders were categorized based on clusters of symptoms. Who is considered the primary architect of the DSM system? A. Émile Kraepelin. B. Philippe Pinel. C. Robert Spitzer. C. Robert Spitzer. Robert Spitzer, an American psychiatrist, is considered the primary architect of the modern DSM system. He played a crucial role in the development of DSM-3 and its subsequent revisions. DSM-2, Diagnostic and Statistical Manual of Mental Disorders, 2nd edition, introduced which significant change compared to its predecessor? A. Introduction of multi-axial diagnosis. B. Inclusion of behaviorally based diagnostic criteria. C. Classification based on biological etiology. A. Introduction of multi-axial diagnosis. DSM-2, published in 1968, introduced the concept of multi-axial diagnosis, where different aspects of a patient's condition were assessed on separate axes. This allowed for a more comprehensive understanding of the individual's mental health. Which edition of the DSM marked a shift towards a more atheoretical, descriptive approach to diagnosis? A. DSM-4. B. DSM-3. C. DSM-5. B. DSM-3. DSM-3, published in 1980, marked a significant shift towards a more atheoretical, descriptive approach to diagnosis. It focused on describing observable symptoms rather than emphasizing theoretical explanations for mental disorders. The DSM-5 introduced a significant change by incorporating a dimensional approach to diagnosis for which disorder category? A. Personality disorders. B. Mood disorders. C. Anxiety disorders. A. Personality disorders. DSM-5 introduced a dimensional approach to the diagnosis of personality disorders, which emphasized the assessment of various personality traits along continua rather than categorical diagnosis. The DSM-5 introduced a new section specifically dedicated to cultural considerations in diagnosis. What is this section called? A. Cultural assessment. B. Cultural formulation. C. Cultural considerations. C. Cultural formulation. DSM-5 introduced a new section called the Cultural Formulation Interview, CFI, which provides a structured way for clinicians to gather information about cultural factors that may influence the presentation and diagnosis of mental disorders. Which international organization publishes the International Classification of Diseases, ICD, system? A. American Psychiatric Association, APA. B. World Health Organization, WHO. C. National Institute of Mental Health, NIM. B. World Health Organization, WHO. The International Classification of Diseases, ICD, system is published by the World Health Organization, WHO. It is the international standard for classifying and coding diseases and health-related problems. Which edition of the ICD included mental disorders for the first time? A. ICD-8. B. ICD-9. C. ICD-10. C. ICD-10. ICD-10, published in 1992, was the first edition of the ICD to include a chapter on mental and behavioral disorders. It provided a standardized classification system for mental disorders on an international level. The DSM-5 introduced a new organizational structure, replacing the multi-axial system with a more streamlined approach. What was the rationale behind this change? A. To simplify diagnosis and increase reliability. B. To allow for better integration with the ICD system. C. To address criticisms of the previous system. A. To simplify diagnosis and increase reliability. The shift in organizational structure in DSM-5 aimed to simplify the diagnostic process by eliminating the multi-axial system and integrating various aspects of diagnosis into a single framework, thereby increasing reliability and consistency in diagnosis.